So we're talking with Chris Charbonneau, who is the regional CEO of Washington, Idaho, Hawaii, and
Alaska.
That's right. Now, we've had a look at the Congressional Budget Office report on the Republican plans to repeal the Affordable Care Act. One big chunk of that focuses on Planned Parenthood. And before we get into the details and all the numbers, on your website, I notice you're calling this the most serious threat to Planned Parenthood patients in their 100-year history.
That's right.
Why is that?
We have never before been threatened with the inability to accept Medicaid, and that's incredibly serious. In the history of Medicaid, which is the program that serves a lot of people, but mostly low-income folks, no one has been ever excluded from Medicaid as a provider if you do the services in question and if you're not convicted of a major crime. And so to single out an organization just because you don't like us for reasons with nothing to do with the actual services we're providing. So the services that we're talking about now are the contraceptive services, the sexually transmitted disease screening and treatment, that kind of thing. That's what's eligible for Medicaid. To refuse to allow us to take Medicaid to serve low-income people with because you don't like that in some places we're abortion providers is completely an inappropriate reading of the law.
Now, Planned Parenthood seems to be working hard to combat a lot of misunderstandings when it comes to this.
Right.
And, for example, when it comes to healthcare overhaul, you describe the term defunding as being a misnomer. Why is that?
It is because we're not in the budget. Sort of the idea about funding is people sort of think there's some giant chunk of money that says, here's the Planned Parenthood line in the budget, and we're going to strike that out. What they're talking about is just not letting us let low-income women use the Medicaid that they get to come to Planned Parenthood. They could take it anywhere else. They just couldn't take it to us. And the problem, of course, with that is we do services no one else does. We do services faster than other people do them, which is a key thing in contraceptive care. We do a lot of specialty kinds of contraceptive things like do implants and IUDs and the kinds of contraceptive methods that are the most effective, and other people do many fewer than that. And we are the queens of sexually transmitted infection abatement.
Oh, abatement.
Yes, abatement. Let's be sure that's in there. We don't cause anything. We just try to fix it. So that is not a role that anyone else plays.
Now, you also talk about the Hyde Amendment, which apparently has been around for 40 years.
That's right.
But according to a survey, a lot of folks have no idea what it is or that it even exists.
So the Hyde Amendment was passed 40 years ago and is renewed repeatedly to not allow any federal funding to go for abortion services. And that's been the law of the land for a long time. There are a couple of minor exceptions to that if someone is literally going to die, for example. But we're not talking about abortion funding when we talk about not letting Planned Parenthood be in Medicaid. We're talking about not giving low-income people the provider of choice that they choose if it's Planned Parenthood for their contraceptive care.
Now, just to play devil's advocate here, if they say, okay, we're going to defund you, this is going to happen unless you stop providing abortions, why not stop? Your other services are so important,
right,
and they make up the majority of what you do, so why not stop?
Because we will never turn our backs on the women who rely on us. And in many, many, many states, Planned Parenthood is the only provider of abortion services that there is. So to say to people in Alaska, we'll no longer do this, or in Idaho, we will no longer do this, there is literally nowhere else to go.
So let's get to the numbers now. According to the Budget Office, defunding of Planned Parenthood for just 1 year would increase Medicaid spending $21 million in the first year, and then there would be an additional cost of $77 million over several years. Now, why would the cost keep accruing if you're only defunding Planned Parenthood for a single year?
Because you get a certain number of pregnancies in the first year, and then you get a lot more pregnancies after that. And you know, this idea of they would only defund for 1 year is a ruse. Like, nobody in the world believes that they would go to all this effort for a single year. And so if you actually think about the pregnancies that would ensue just from defunding Planned Parenthood at all, and then you start multiplying the costs for children that have to be then maintained by women who can't afford to have them for, you know, many, many years after that, there is no way this pencils. This is not a mathematical equation. This is strictly about people who hate women being able to make their own life choices, being able to do that, and going after the provider that makes it possible.
So we've already seen a microcosm of this in Texas, where they cut the state funding for Planned Parenthood in 2013. they saw their pregnancies increase by 27% in just the first 18 months. Now, according to the Republican health care bill, women using birth control services at Planned Parenthood could just find another federally funded provider. But it turns out it doesn't really work that way. It's not quite that simple. Can you explain that?
That's right, because in many places where there are Planned Parenthoods, there are no other providers. Paul Ryan made this argument, and in his district, there are two major cities where there's only Planned Parenthood. There are no other federally qualified health centers, the kind of which he's talking about can just pick up the slack. The other thing is Planned Parenthood sees 2.5 million women across the country. You suddenly say, hey, they can all just go somewhere else. That's a traffic jam. And there are not a lot of providers. You know, many of us know, having made appointments, you don't just call up your local OBGYN or your local other doctors and say, I need to come in now. They're likely to say, 4 to 8 months, we can see you. We'd be happy to. That is a recipe for disaster when you're talking about unintended pregnancy prevention.
Yeah. So the Congressional Budget Office says that cuts to Planned Parenthood would have an especially big impact when it comes to rural areas, that 15% of all women in those areas would lose their access to this kind of health care. And I'm wondering if that holds true for the state of Washington, what that looks like here in our rural communities.
Absolutely, it does. Most Planned Parenthood clinics, and we have a few obviously notably big ones in big cities, but most of them are in suburban or rural areas. That means people in cars for 30, 40, 60, 80, 100 miles sometimes.
Now, it seems like you maybe have an easier job than some of your cohorts around the country.
No question.
The West Coast, is pretty friendly when it comes to Planned Parenthood.
Right.
I'm wondering, what are your conversations like with your cohorts in the middle of the country, and what kind of battle are they facing?
Literally, my colleagues in Texas had 16 different state of Texas separate entities auditing them at the same time. That's what harassment looks like. And, and in my colleagues in Florida had the local health department invent results that then they had to recant for an audit that they said that the affiliate didn't pass. It's been ridiculous. My colleagues in Indiana, where Mike Pence was the governor, found themselves defunded from not Medicaid but the state funding. And it was estimated, because of the clinic closures that had to happen in Indiana, because people weren't able to get HIV testing and things on a timely basis, that there are an estimated, according to medical journals, 300 people in Indiana that now have HIV that would not have had they not defunded Planned Parenthood.
Yeah, since I did a little research before you came in today, I noticed there are lots of journal reports. These are not just Planned Parenthood numbers, but these are medical journals that are coming up with these numbers.
You don't have to believe me. There are people who do research for a living and have peer-reviewed journal articles, the statistical validity of which is obviously verified. And they're saying this is not the kind of smart thing a government needs to be spending its time on. If anything, people who do family planning, including Planned Parenthood, are solutions to a giant problem. We're not the problem. And here in the Seattle area, we're very proud to have the lowest, except for Boston, and we're right on their heels, unintended teen pregnancy rate in the country as a result of long-acting reversible contraception, good sex ed, access, next day, same day, access to Planned Parenthood. That's what we know breeds success in this kind of a program.
And unintended pregnancies can have a big effect on the young woman who's getting pregnant, obviously, but there are long-term consequences for her family, her children, and society. It's something that Melinda Gates talks about a lot, about how important contraceptives are, not just for the family in the immediate and the financial future, but for their ability to create the life that they want for themselves and for their family. So can you talk about why is that so important?
Sure. The difference it makes from being a 16-year-old parent, from even being a 19-year-old parent, even to buy yourself 2 or 3 years where you can get yourself on your feet, get yourself economically organized, have those kinds of stresses be less prevalent for the family, can make all the difference in sort of the regularity of how these kids can grow up. And if you paint young women into certain kinds of corners, you get nothing but difficult results. And so I think it behooves us all as a society to be as supportive as we can about young women who want to plan. And to that end, we have been shocked since the election. We were doing 700 long-acting reversible contraceptive methods a month before the election. And those mean the IUDs, the implants, the things that you can install that nobody has to remember to use. And after the election, it's been 1,900 a month. People have been terrified that they will find themselves without insurance or without the ability to get these sort of expensive but worth it long-acting reversible methods. And they've been running into Planned Parenthood to get that done.
Now, this is a possibility, as remote as it may feel at the moment. This is definitely a possibility. Are you guys making plans for what will you do if it happens?
If we were to lose the vote, the repeal replace would include a Planned Parenthood rider, the likes of which we've seen so far. It's our intention to go directly into court to get a stay while the government argues about it. It's not legal to single out a single organization and make a law about them. It's not legal to single out one person and make a law about them. Laws are for general application. They're not for specific revenge purposes, either political or, just because you don't like someone or you want to take something out on someone. So we believe that we'd be in good position to defeat our inclusion in such a bill on a legal basis if that were to happen.
Now, if they were to change the wording so that it was applicable to more than just Planned Parenthood, that might take away some of that legal argument. Do you have a backup plan?
Yes. Well, then you argue the harm that would come to your state or your county or whatever if this should happen. And I think the harm is already documented. Texas caused harm. Indiana caused harm, doing something far less invasive than what's being contemplated here. So I think that a judge would be hard-pressed to say that this doesn't have mitigating factors involved that haven't been considered. It's also very clear that the legislature has said over and over again, the defund of Planned Parenthood is here in our bill. I mean, they're not trying to hit anybody else. They're just trying to come for us.
Yeah. Have you talked with the state attorney general about this? Because he obviously is not shy about going after the Trump administration.
He's been super busy as it happens. But, I was inspired by that. I mean, quite clearly, the very same argument was applying. He was saying the state of Washington would be harmed if we were to ban this kind of travel. And I think there is no question but the state of Washington would be harmed if suddenly women didn't have access to the care they need to make planful parenting decisions.
So have you spoken to him or no?
I have not yet had a chance.
But maybe.
But I absolutely will pick up the phone as soon as he has a breathing moment.
Right. Yeah. Now, if let's say down the road you lose the court battle.
Right.
This could be quite a ways away.
Yeah.
But you lose the funding.
Yes.
The Medicaid funding.
Yes.
Do you have a plan for that?
We do, and it's super ugly. I mean, to lose that much funding, and for Planned Parenthood of the Great Northwest and the Hawaiian Islands that serves our area here, it would be a loss of about $12 million out of a $50 million budget. That's a big chunk. And we would not be able to keep everything open the way we have it now if we did. So there would be any number of clinics that we would have to pare down. There would be any number of education sessions we would have to cease doing. There would be just a tremendous change in what Planned Parenthood is able to bring to our communities, and it would be fairly catastrophic in terms of its results. But we would do what we had to do to live to fight another day. And I would like to think that Washington wouldn't tolerate elected officials that put up with that kind of thing.
Yeah. Has the legislature promised any kind of support if we get to that point?
Various elected officials are looking at that, but Washington has a great many budget problems of its own. We have this McCleary issue in our state and a variety of other things. And so we're just hoping, we also sort of believe that the federal government has sort of an obligation to fulfill its usual rules. There is no thought that by taking Planned Parenthood out of the budget, they're saving money in the budget. When Texas did it, they were very clear. They were challenged and they said, we don't believe we're saving money. We know that this is going to cost us a bundle and we don't care if we can get this result. And it's a bad result for Texas women. I don't, obviously Washington State is not Texas.
Right.
And I don't think we'd hear any elected official making those kinds of claims here. But ultimately, bad is bad if that's what ends up happening. So we have to do everything in our power to see that it doesn't.
Yeah, looking at the Texas example, they've been successful. I mean, the state defunded Planned Parenthood years ago. They were challenged on it,
Right.
but it stands.
They were challenged on it, and in order to survive the challenge of doing that, they gave up millions of dollars in state funding for their Medicaid program. They gave up their entire women's program to allow them to defund Planned Parenthood. That's a commitment to the wrong side of justice that I rarely see in elected officials, especially in elected officials that want to get reelected. And in a state like this, that wouldn't be possible.
Well, I think sometimes coming from Washington, we look at this and say, there is no way that's going to happen. That
Right.
doesn't make any sense.
Mhm.
They're not going to pass it. But the fact is, there was a state that passed exactly what this is doing.
Right.
And so it very well could happen.
Yeah. Yeah.
What's the reality check that you want to give to people to maybe get them to help, you guys get that maintain that funding?
Well, everybody, the 170,000 people in this city who marched the day after the inauguration, all the people who marched in all the cities in Washington state the day after the inauguration, the people who've just been sitting at home saying, I don't know, I'm just uncomfortable with the way that this is going, even if you never marched and never will. We sure could use your help in weighing into your elected officials. We have three, including Jamie Herrera Butler down by Portland, but we have Dave Reichert in the 8th over in Issaquah and parts east, and we have Kathy McMorris Rogers in Spokane, who both voted for this. And if you don't like that, I would urge you to tell them, especially if you're one of their constituents. Because people will do what they think that their constituents will put up with, and if their constituents won't put up with that, we'll get a different result.
Were you surprised by those votes?
No, I was actually anticipating those results, but I think it's really a bold maneuver right now. I mean, the whole storyline that somehow something needs to be done immediately for Obamacare because it's headed for failure is just simply mathematically not true. And so to uninsure millions of people on sort of a fake news basis by misquoting things and all the while be forwarding a plan that actually takes a huge amount of money out of the healthcare system. Makes healthcare especially onerous to get for older, sicker. By older, I mean people under 65, but like between 30 and 65. Let's be clear, we're not talking about the Medicare population. But so those of us who are older, I include myself in that bunch. It makes some healthcare just incredibly difficult to get, and it takes a tremendous amount of nerve to put something like that forward and claim you're actually helping someone.
Yeah. So when you look at the changes that you have seen as Planned Parenthood since the Obamacare Act first went into effect, what did that do for you guys and for your patients? What was the change that you saw there?
Unbelievable. We, of course, serve a lot of the folks that were most benefited by it. And when people say no one can get insurance, simply not true. We at Planned Parenthood had people helping sign people up, and hundreds of thousands of people in this state got signed up. And what that means is that more and more of our neighbors who don't have very much were able to join the rest of us who are lucky enough to have employer insurance in taking care of their health. And for a long time, we saw pent-up demand in the health centers of people who hadn't had care for a very long time. And finally, we're getting that pap smear and dealing with, the precursors to cervical cancer or the lump in the breast check and all of that. And it was our honor and privilege to be able to serve those folks and make sure that they got respectful care finally. And so many people came and said, I've been on decent methods before, I've been on pills and that kind of thing, but I really want to try, a new generation IUD or an implant or something like that, something that can last me for 5-10 years, many of these methods. They are not, in fact, cheap. Buying something like that out of pocket with a visit is well over $1,000 for someone who does it. Planned Parenthood can do it for less, and we have funding in order to make that possible because we're not the victim of the kind of thing that we're talking about right now. But if we were, all of that disappears. All of those advantages disappear. The incredible progress we've made since 2008, the unintended pregnancy rate among teenagers in this community has gone down 55%.
In this community, meaning?
Seattle.
Oh, wow.
Seattle and King County. And if we aren't able to do the kinds of things we were doing to get that success, that all comes unwound.
Yeah.
And so are we willing to let that kind of thing happen? Are we going to snatch defeat from the jaws of this victory? Or are we going to get ourselves together as a voting community and say, I don't think so?
Now, one other interesting thing I noticed when I was looking at your website today is that you're starting to offer more services, more primary care services. Right. What is that, and why are you doing that?
Well, we did discover as we, have people with insurance that many of them only have us to take care of them. One of the things that happened in healthcare reform is that there were not enough providers to provide everybody care. We just haven't graduated enough doctors and nurses when you add the extra 30 million people. And so people kept saying, I just need one other thing other than what you're already doing for me as a young woman. Young women need the head to toe physical. They need pap smears. They need breast care. They need contraceptive care. But if they have colds and flu or an earache or, we've always treated bladder infection, that kind of thing, because, our skill is knees to nipples. But we added on additional body parts for people who just needed a few more things in order to sort of say, really, as a young, healthy woman, you are my primary care provider. And that's what we've striven to provide for them.
So is that available at all your clinics now in your region?
We're expanding to all of them. We're not in all of them quite yet. So call our phone line, and the folks there will help direct you around.
All right. Chris Charbonneau, the CEO of the regional area for Planned Parenthood. I think that's all I wanted to ask you today. Is there anything else that you would like to talk about?
Well, I just thank the community for the tremendous outpouring of support for Planned Parenthood that we've seen. People have been standing shoulder to shoulder with us, and, that's why we never want to let you down. So thank you all very much out there.
All right. Great.